Consider the world before modern medicine, a time when simple infections, minor wounds, or childbirth complications could end lives. Pain, disease, and death, everyday companions of humanity for millennia. Then imagine a handful of individuals across ages and continents who challenged that fate. People who observed, questioned, experimented, and changed the rules of what a doctor, or a healer, could do. Their breakthroughs saved millions, shifted paradigms, and laid the foundation for modern health, hygiene, surgeries, immunology, and even public health itself. Today, I want to take you through some of those towering medical figures, not mythic heroes, but real people whose work still pulses through every hospital, clinic, and life saved. If you care about human history, not just wars and politics, but survival, suffering, resilience, stay with me. Our journey begins with Hippocrates, often hailed as the father of medicine. Living in ancient Greece around 460 to 370 BC, Hippocrates shifted healing away from superstition and divine punishment toward observation, diagnosis, and natural causes. He emphasized careful clinical observation, detailed records of patients' symptoms, and the concept that environment, diet, and lifestyle influence health. His legacy was not only medical technique, it was ethos. The principles often associated with the Hippocratic Oath helped establish medicine as a respected profession guided by ethics and care rather than fear and superstition. That transformation from mystical healing to empirical medicine laid the ground for every doctor, surgeon, or researcher who followed. Recognition that disease could have natural causes, that careful observation and ethics matter. These were the bedrock. Centuries later, advances in anatomy, dissection, and surgery propelled medicine forward. Among the most influential was John Hunter, a Scottish surgeon whose insistence on careful observation, dissection, and scientific method redefined surgery and anatomy. Hunter amassed thousands of anatomical specimens, human and animal, providing concrete understanding of structure, development, and variation in anatomy. His work formed a baseline for safe surgery, anatomical knowledge, and surgical training. Later, surgeons such as Emil Theodor Kocher refined the practice further, pioneering thyroid surgery and introducing antiseptic methods that drastically reduced surgical mortality. Their contributions show how medicine matured, from guesses and tradition to methodical scientific practice grounded in empirical evidence. Anyone today studying medicine, anatomy, or survival medicine should trace their roots back to figures like Hunter and Kocher, because their methods still guide safe treatment, emergency surgery, and anatomical understanding. Another leap forward came not from better tools alone, but from better understanding that diseases arise from microscopic organisms. Louis Pasteur, living from 1822 to 1895, was instrumental in proving germ theory, the idea that tiny microbes invisible to the naked eye cause disease. This honestly overturned centuries of miasma-based thinking and opened the door to modern microbiology, sterilization, public health and, well, vaccination. Building on that, pioneers like Edward Jenner, who lived from 1749 to 1823, used early observations to develop the first successful vaccine, targeting smallpox, a disease that had ravaged humanity for centuries. Jenner's approach, using cowpox to build immunity, laid the foundation for immunology, vaccination programs, and the notion that prevention could be more powerful than cure. These breakthroughs transform medicine. People realized that survival need not rely solely on treatment after the fact, but on prevention, hygiene, sterile methods, and immunization. For historians or survival-minded thinkers, that shift matters. It changed not just individual lives, but the resilience and health of entire populations. Medicine's progress wasn't only in individuals or discoveries, it was institutional. Sir William Osler, who lived from 1849 to 1919, one of the founding physicians of Johns Hopkins Hospital, reformed medical education. He introduced structured residency training for physicians, insisting on practical experience, clinical rounds, ethics, and lifelong learning. Osler helped transform medicine from craft or apprenticeship to a structured profession grounded in knowledge, discipline, and continuous improvement. Thanks to figures like Osler, modern medicine today, whether in major hospitals or rural clinics, benefits from standardized education, ethical practice, professional care, and organized medical libraries and documentation. For you, as someone interested in history and survivalist perspectives, Osler's influence shows how medicine evolved not just through discoveries, but through institution building and standards. Studying these medical giants gives more than historical knowledge. It gives tools for critical thinking, risk assessment, and preparedness. If you research global health, epidemics, or plan for disaster or survival preparedness, knowing germ theory helps understand how epidemics spread and why hygiene matters. Understanding surgical and anatomical advances reminds you what is possible even with limited resources. Recognizing the importance of medical education and institutional care underscores why investing in training and organization, not just equipment, can save lives. If you study social history or human resilience, these stories show how ideas, ethics, chance observations, and perseverance changed human fate. A vaccine invented centuries ago still saves millions. Antiseptic surgery developed in one era keeps people alive today. Medical education reforms made doctors across continents more effective. If you're a documentary maker or writer, these medical pioneers offer powerful arcs: struggle, discovery, resistance, revolution, human impact. Their lives can frame stories of disease, survival, hope, morality, science, and social change. Famous medical figures are more than names in a textbook. They are the architects of human survival. Their work, grounded in observation, experimentation, ethics, and compassion, turned medicine from superstition to science, from crude treatments to controlled surgery, from ignorance to prevention. Understanding their contributions isn't optional for a serious student of history or survival. It's essential. If you found this guide valuable, make sure to subscribe for more deep dive content on medical history, human resilience, and survival-aware geography or history. Share this with fellow history buffs, medical history fans, researchers, or anyone who cares about how our world was shaped by healers and pioneers.